Today we will discuss about the coronary arteries. As you can observe, I have indicated a diagram of the heart. Also, we can see the aorta and the pulmonary trunk. From the pulmonary trunk, I have removed the portion to have a better view over the origin of the coronary arteries. First, we will discuss about the left coronary artery and its branches. The left coronary artery, abbreviated LCA, is an artery that arises from the aorta above the left cusp of the aortic valve and feeds blood to the left side of the heart. After running for about 10 to 25 millimeters, bifurcates into an anterior interventricular branch and the circumflex branch. As you can observe, the anterior interventricular branch reaches the anterior interventricular sulcus, along which it descends to the notch of the cardiac apex. The circumflex branch follows the left part of the coronary sulcus, running first to the left and then to the right, reaching nearly as far as the posterior longitudinal sulcus. Now we will put down the branches from the anterior interventricular branch of the left coronary artery. And first I have indicated a branch to the conus arteriosus, or the conus branch. This branch supplies the infundibulum. With D1, D2, and D3, I have indicated the diagonal branches from the anterior interventricular artery. The anterior interventricular also gives off septal branches from S1 up to S16. Those septal branches supplies the superior 2/3 of the interventricular septum. From the circumflex branch of the left coronary artery, we have atrial and ventricular branches. Another important branch from the circumflex artery is the left marginal artery, or the obtuse marginal artery. This artery travels along the left margin of the heart towards the apex of the heart. Using the green color, we will discuss about the right coronary artery. The right coronary artery, abbreviated RCA, is an artery originating above the right cusp of the aortic valve. It travels down the right coronary sulcus towards the crux of the heart. From the crux of the heart, continues with the posterior interventricular artery, or the posterior descending artery, which is an artery that is running in the posterior interventricular sulcus to the apex of the heart, where it meets the anterior interventricular artery. As you can observe, I have already indicated septal branches from the posterior interventricular artery. From the right coronary, we also have some atrial and ventricular branches. A much obvious is the right marginal artery, or the acute marginal artery, which will supply both surfaces of the right ventricle. Now we will put down the blood supply to the sinoatrial node, abbreviated with SA, and the atrioventricular node, abbreviated with AV. In about 40% of the cases, a sinoatrial nodal branch comes from the circumflex branch of the left coronary artery. And in about 60% of the cases, this sinoatrial branch to the sinoatrial node originates from the right coronary artery. In about 20% of the cases, we have an atrioventricular nodal branch, which originates from the circumflex artery. And in about 80% of the cases, this atrioventricular nodal branch originates from the right coronary artery. To conclude this video, we will discuss about the dominance in the coronary circulation. And we will start with the much common right dominant coronary circulation. We have a right dominant coronary circulation in the situation where the posterior interventricular branch, or the posterior interventricular artery, originates from the right coronary artery, like the case we have already discussed. This situation occurs in about 89% of the population. In the left dominant coronary circulation, the posterior interventricular artery comes from the circumflex branch of the left coronary artery. In this case, the circumflex artery, once it reaches the crux cordis, or the crux of the heart, it becomes continuous with the posterior interventricular artery along the posterior interventricular sulcus. But obviously, this is a particular situation. As we have already discussed, the posterior interventricular artery usually comes from the right coronary artery. The left dominant coronary circulation occurs in about 8% of the population. The codominant coronary circulation is the situation in which the posterior interventricular comes from both right coronary artery and the circumflex branch of the left coronary artery. This situation occurs much rarely in about 3% of the population. That's all for today. I hope this video was useful for you. See you next time. Bye.